Welcome to the Perry Prosthetics How-To Video Series. In this video, Perry Prosthetics founder and prosthetist, Chris Perry, will demonstrate the proper technique for wrapping a residual limb.
Thanks for coming in and helping out with this, Eileen. Today we're going to demonstrate doing an elastic wrap over a residual limb to control edema and promote shaping of the limb for prosthetic use. Where we're going to see the elastic wrap used most is post-operatively over soft dressing, where a physician may not want to order a shrinker sock to pull on the limb. First of all, I always recommend a double length wrap. And if you have one that has Velcro, that's great. If they come with these little clips, those clips come off and they go in the trash so that we do not cut or scrape our patient. And I would get them out of the way immediately. What's known as the figure 8 wrap is very effective in not only creating a gradient pressure from the distal to the proximal end of the limb, but if it's done right, most of the patients that I've wrapped have shortly afterwards reported that the limb is more comfortable. And anything we can do to make our patients more comfortable, particularly post-operatively, is crucial. So you can start. I'm right-handed, I'll start this direction. If you're left-handed, you start this direction. So the way I do this is my first step is simply to be concerned about getting distal coverage. So I'll start here, I'll pull this around the outside distal end of the limb, and then I'll bring it around and catch this flap. I'll come around, only pulling really enough stretch out to keep wrinkles from coming in, and then I'll catch this corner of the limb. Okay, now that I have the distal end coverage with some compression, I'm going to come around the back. When I come around the back, I only take out enough stretch to remove any wrinkles. I come back down around this corner and I take out 50% of the stretch. I come around. I'm going to go actually around one more time because her limb is very tapered. I'm going to go around without the stretch. I'm going to come back and catch this corner one more time. From here, I can now go right without stretch, come down, take out about 50% of the stretch. While I'm here, I come back around this side, take out about 50% of the stretch, and I come up. You can see now that I'm layering, you can do 3/4 to an inch above the last one. There's my last wrap, here's this wrap. The next wrap will be up higher. So again, I come up, I only enough stretch out to get rid of wrinkles. I come around, I come down about an inch from this layer, take out 50% of the stretch, come around about an inch from this layer, take out about 50% of the stretch, around, I don't take 50% out, I just pull it enough to get rid of the wrinkles, come back down and just continue that. And you follow that pattern. And as you continue, I like to do the extra long wrap so that you can get above the patella and the condyles, because that helps hold it on when the patient's moving. 50% out, 50% out, and then just nice and relaxed. Come back down, 50% out, 50% out. And this is if you come over here, this is what you should see when it's complete. And it's going to be tighter distally, and as it goes up, it'll be looser. How's that feel, Eileen?
Feels good. Feels good and tight.
So that's it. I use tape. We don't have if this one don't have Velcro, and it doesn't have those clips, so I just use paper tape to tape these in place. If you have somebody that there's a lot of mobility, or you're concerned about it moving, this one's on there very well. It's not moving. But if you do, you can take a piece of tape and run it down the length, and it kind of anchors those all together. Very good.
The team at Perry Prosthetics is always available to answer questions from patients, family members, and medical professionals. Contact us at any time.